When it comes to women's health, our longevity, our hormones, what's going on with our weight, what's going on with our bodies, we just want the truth.
You want answers? You can't handle the truth.
Your friends are telling you one thing. You're reading something completely different in headlines. But what your own doctor is telling you doesn't align with any of that. When it comes to your hormone health, you don't want to make a mistake. You don't want to put yourself at a higher risk of having cancer or any other disease for that matter. You want to feel great. You want to feel like yourself again. Unfortunately, the media and the medical community has not made this easy. There's so much information out there, it's hard to know where to start. How to find a provider? Is it too early to be thinking about these things? Is it too late? Or are you even a candidate? I set out to get the answers from the world's most renowned menopause experts. I asked them to weigh in, to give us the truth, to give us the answers to your most frequently asked questions. So whether you're 35 or 65, it doesn't matter. This information is critical. So without further ado, welcome to the Chalene Show. So I am officially in the after party, which I like to refer to menopause as the after party because it literally can be an after party if you've got the right information. But for so many of us, either you're past the point of being menopausal or you haven't even hit it yet. So it's not on your radar, but it should be. It was when I was in perimenopause that I was getting so much information and really confused by what was the right thing. Like I was reading books that were saying one thing, I was reading headlines that were saying quite another. And then there was my general practitioner who I've been working with for more than 20 years, who was telling me something completely different from all the information I was consuming elsewhere. It was really confusing. All I wanted was the truth. I didn't want to put myself at a higher risk of having breast cancer. I didn't want to put myself at a risk of dying young or not having like optimal health. I just wanted to feel like myself again. I didn't want to make a mistake. And I wanted the experts to just tell me what to do. So today, that's exactly what I did. I went to the top experts who are on the front line of women's health, specifically as it relates to hormones. These are experts in menopausal care, women who are trying to help those of you who are 35 and older to understand you need this information now before menopause, and also to try to reach those women who are past the first couple of years of menopause. Maybe you're in your 60s or 70s and you're wondering if you're still a candidate. I got answers for you. I got the facts, and we've got research to back this up and the most sought after, in-demand experts in menopausal care. Now let's talk to urologist, top podcaster. She's an author. She's a doctor who's devoted to helping women understand what's going on reproductively, to understand their sexual health, to understand what they can do to optimize their health. She works in person with these women every single day. My friend and friend of the show, Dr. Kelly Casperson. Fact or menopausal myth? Symptoms end once you're officially in menopause.
No, that's a myth. So symptoms, there's like 30 or 50, depending upon who you want to talk to, symptoms of menopause. And remember, menopause, the definition of menopause is no more periods after a year of no more periods. So that's menopause. What it means, though, is profound loss of the hormone producing cells of the ovary. So your symptoms can just keep going. A lot of women will start having symptoms years after menopause and they have no idea it's because of profound low hormones. So you are not in a symptom-free zone just because you haven't had periods for a year. That's a myth.
Okay, fact or menopausal myth? Natural remedies are always safer than hormone replacement therapies.
That's a myth. So remember, in America, the supplement industry is completely unregulated. Oftentimes there's stuff in there that can be bad for your liver. In addition, a lot of things on the label aren't even in the package. So I would say it can be buyer beware, right, for supplements, or people think of supplements as like natural. Also, natural things like having a healthy diet, exercising, prioritizing sleep, all very good for you, do tend to decrease things like hot flashes, but none of that works as good as hormones. And if you think about it, our natural hormones, what our body makes naturally, what is more natural than that? Some people just don't like the idea of taking a medication every day. They think that's unnatural, but you're actually just putting back what your body made, like insulin, thyroid, vitamin D, all those things that our body naturally makes, but we supplement when we're low.
Okay, fact or menopausal myth? If your practitioner says that you are not a candidate for HRT, they know more than you, so just zip it. and deal with it.
That's usually a myth. Most people, and I'm overgeneralizing, but we have data to support this, most doctors did not get trained in the profound hormone changes when a woman ends her periods. So they usually don't know unless they got specifically trained. So feel free to see a second opinion. Feel free to seek out somebody who has taken advanced classes or has had training in menopause, because most doctors don't know, and they're often overly conservative, which is good, but it's usually because they aren't up to date with the current data.
Fact or menopausal myth? If sex is painful, you should just stop having it. Duh.
Yes, we don't want to do things that hurt, but that doesn't mean there aren't solutions. I just don't want you to do things that are painful.
UTIs, weak bladders, all these things are normal after 40, so maybe just invest in some Depends.
Urinary tract infections, weak bladders, and pain with sex are normal after 40. Just because things are common doesn't mean they're normal. So bladder leakage, recurrent urinary tract infections, and that overactive bladder, which is urgency, frequency, getting up at night to pee, all because of dropping estrogen. Again, for some people, this happens years after their last period. Normal? No. Common? Yes.
Thank you, Kelly. You're the best. We love having you on the show. Okay, let's ask Dr. Kathleen Jordan. She's the Chief Medical Officer at Midi Health. She leads a team of practitioners who are devoted to helping women with their care who are in perimenopause and menopause. Okay, Dr. Jordan, first frequently asked question, I guess we'll frame it as a statement. The best time to consider HRT is around age 50. Fact or menopausal myth?
Fiction. You should begin to discuss and have informed conversations around hormone replacement therapy whenever you have symptoms. And for many women, that is before 50, and for some women, it's after 50. So it is not driven by age.
Okay, next one. Fact or menopausal myth? Whether you use patches or creams or pellets or injections, it's really about the patient's personal preferences, that combined with what the practitioner prefers to recommend, but there really isn't a universally accepted singular form of hormone replacement that all practitioners say, okay, this is the gold standard. Fact or menopausal myth?
Yes, I'm going to say that is fact. There are lots of different formulations, and you should find the one that is right for you. It will depend on your symptoms and your preferences, absolutely, and it's always a conversation.
OBGYNs are the best place to turn for hormone support because they're specifically trained in this area. Fact or menopausal myth?
This one might surprise you because I am going to say fiction. Some OB-GYNs are certainly trained in menopause, but the majority, 86%, will actually say they're not trained in menopause. In addition, we have people from other specialties, primary care, we have nurse practitioners, there's DOs, there's other specialties that train in menopause. And if you look at the Menopause Society, you'll see lots of different specialties training in menopause.
By the way, if that's something you're trying to figure out, is like, where do you find a doctor or clinician or a practitioner, someone who's specifically been trained in menopausal support and hormones and perimenopausal, and what are the symptoms and what is the latest as it comes to the research and the studies for our optimal health? If that's something you've been struggling with, you're not alone. I think it's probably like the number 2 most common question I get. Until recently, I didn't have an answer. I would say things like, ask your friends, ask for referrals, look on Yelp, which isn't always a great source. And then I discovered Midi Health. It's one of the reasons why Midi Health is a sponsor of the show, because once I experienced their services and I started doing my research to really, truly understand, like, okay, how is it they find their clinicians? How are their clinicians trained? And how does this solve a problem for my audience? Then I reached out to them and asked them to be a sponsor of the Chalene Show. So this is how Midi Health works. Midi Health is a virtual care platform designed specifically for perimenopausal and menopausal women. That means you can continue working with your GP or your OBGYN or whatever doctor you have a history with. But with Midi, you have access to a clinician who's specifically trained to help you with hormones. And they accept insurance, and they're in all 50 states. They're super affordable. And what I love about Midi is that you're guaranteed that your practitioner is going to listen to you. I've used them myself. I use them for my estrogen cream up here and a few other things that we won't get into. I was really impressed when I had my first consultation with Midi because the practitioner got on the phone, like, first of all, I filled out a really extensive and well thought out questionnaire. Like really, I was like, okay, just this questionnaire alone is more time than anyone has spent with me talking about hormones in the past. Like it really helped me to understand and identify some of the symptoms that I was experiencing that until I went through that form, I didn't even realize like, oh, wow, this is probably related to my hormones too. I was very impressed. And I think you will be too. So to book your virtual appointment with a hormone specialist, go to Chalene.com/MIDI. It's MIDI, Chalene.com/MIDI. I've recommended them to my friends. I've recommended them to my mom. I've recommended them to coworkers, and I've heard nothing but glowing responses. So give them a try. If you don't already have a healthcare provider, this is not replacing your in-person provider. With Midi, they can work with local pharmacies for you, and they can actually even work with your treating physician. So give them a try. It's Chalene.com/MIDI. All right, back to your questions. Now I want to check in with one of my favorite experts, Dr. Kirsten Singler. She's from Huntington Beach, California. She practices every single day in clinic, been treating women and men, helping them to understand how to have optimal health, how to combine lifestyle, combine natural remedies, as well as hormone replacement therapies and peptides and all the things. She's one of my favorite people because she just geeks out on the science of this stuff. So I wanted to ask Dr. Kirsten, fact or menopausal myth? You can take a urine test and know with certainty if you're in perimenopause.
I'm gonna go with facts, although it depends on what urine test you're talking about. There's multiple different urine tests that are out there on the market, but I'm assuming that you're talking about a test commonly used in the functional community that's called the Dutch test. The Dutch test is a urine test that maps out the hormones through multiple phases of a woman's cycle. It captures the hormones during the follicular phase, ovulatory phase, and then the luteal phase. And it maps out the estrogens, testosterone, progesterone, DHEA, pregnenolone. It maps out all of the hormone metabolites. And in some ways, the Dutch test is more exquisite. It's more biochemical. It tells you a whole lot more about what's going on there with a patient. I don't always use that test. Actually, I use blood lab tests more frequently because blood lab tests are going to be covered by insurance. And you can still map out what's going on in the multiple phases of a cycle. At the end of the day, the labs that you're mapping out are going to be your hormones, estradiol, progesterone, testosterone, pregnenolone, DHEA, and then you're also tracking your FSH, follicle stimulating hormone. And whether it's through a blood lab or through tests like the Dutch lab test, you're still going to get a really good idea of what's going on there. And it's going to help you figure out if you're in perimenopause or not.
Fact or menopausal myth? Most women won't start to experience symptoms of perimenopause until about 1 year prior to menopause.
I'm going to go with myth. Obviously, the process of perimenopause and menopause varies greatly per individual. Some women are going to go through perimenopause during a much longer period of time. It could be 5 years, it could be 10 years. Same for their menopausal symptoms. It can be gradual, it can be abrupt. So, no, we can't just make an assumption that starting at age 49, she's starting perimenopause, and then on at age 50, the bell tolls and then she hit menopause. It's not like that. There's a lot of individual variance with this.
Okay, Dr. Singler, next question. So if a woman is doing hormone replacement therapies, she doesn't need to worry about natural remedies or taking vitamins and minerals to supplement in order to have optimal health.
I would say this is a myth. In my opinion, what makes a good hormone plan or anti-aging plan is to treat the whole person, to evaluate how well are they absorbing their minerals, what's going on with their thyroid, what's going on with their cortisol, what's going on with their basic kidney, liver, cholesterol, blood sugar, insulin levels. You really want to get a good big picture overview so that you can have optimal health. Vitamin D is so important for your brain and your bones, your immune system. Magnesium is so important for your nervous system and your muscles and your brain and your gut function. Zinc is so important for your hair. What if you're on HRT and maybe you're on testosterone, but you're having hair loss? Is it because you're on too much testosterone, or is it because you're actually low in zinc and you need zinc? Other nutrients would be like your iron. A lot of women are low in iron. They have anemia that needs to be replenished. It needs to be evaluated. Why do they have anemia? Iodine and selenium, those play a role in your thyroid function. And if your thyroid is misfiring or it's not optimal, you can have a whole myriad of symptoms that might present like hormone symptoms, but it's actually just a nutrient deficiency. Other things, other factors would be your cortisol. If the cortisol is too high, that's going to be problematic. That's going to mess with sleep. It's going to mess with your metabolism of your hormones. Your liver function, is that working appropriately? Because your liver is basically where you're going to conjugate and deconjugate the hormones. So if the liver's not working well, that needs to be figured out. So at the end of the day, optimal health is going to be evaluating for all of these values and really making sure that your inner milieu is up and running and you're ready for the next decade or more of your life, and that your body's going to perform for you.
Fact or menopausal myth? If you are a woman over 40 and you're experiencing sleep disturbances, it is more natural to supplement with progesterone versus an over-the-counter sleep aid.
I'm going to go with fact, with the caveat that you've done the workup and you figured out that she is actually low in progesterone and she needs progesterone. The thing is, you can't hang your hat on the age 40 because many women can go through perimenopause at a different age. They could go through perimenopause earlier in their 30s. They could go in their 40s, they could go in their 50s. Sometimes I don't have patients go through a menopause until they're closer to 60. Also, I have patients that will need progesterone at a younger age, and it's not due to perimenopause necessarily. It's because they have maybe PCOS, some other endocrine disorder. Maybe they have MTHFR that's really messing with their progesterone production. And then you also want to make sure that you're not missing other factors, right? Other factors that can cause sleep disorder would be a nutrient deficiency like vitamin D, magnesium, other hormone imbalances like a testosterone deficiency. They might have cortisol abnormalities. Maybe their cortisol is high throughout the whole day, going into the evening when it really should drop off. Maybe they're not making enough melatonin. Their sleep hygiene is off. There's sleep disorders like sleep apnea that you definitely don't want to miss. There's mold exposure in the bedroom. I see that all the time here in Orange County. Black molds like Stachybotrys, Aspergillus can absolutely mess with the central nervous system. Some people are sensitive to caffeine. They really have to avoid caffeine to get a good night's sleep. There's psycho-emotional stressors. You know, maybe a patient doesn't need progesterone. She needs like an EMDR or some kind of psych support, cognitive behavior therapy, something to help her move through a different relationship stressor that's going on there. So you just don't want to miss out on those other root causes. But say you do all that workup, you figure it out. You figure out that she is low in her progesterone. Yeah, absolutely. Progesterone is going to be more protective than an over-the-counter sleep aid, because when there's low progesterone, then the patient runs the risk of what's called endometrial hyperplasia. Endometrial hyperplasia can cause frequent period, can cause heavy periods, and then that can lead to anemia. And then worst case scenario can lead to endometrial cancer. So if a woman's low in progesterone, you supplement the progesterone, then you're going to help prevent those other problems that an over-the-counter sleep aid is not going to do.
If you're a woman over 40 who feels like your best years are behind you, let me stop you right there. Nothing could be further from the truth. You have the potential to keep getting better. in how you look and how you live and how you show up in every part of your life. I want to invite you to an all-girls over 40 getaway. This is your opportunity to flip the script on aging. I want to show you it's possible to feel stronger, more confident, and more fulfilled than you ever thought was possible. Yes, you can have more energy, more vitality, even a better body than you did at age 30. You need to be at Camp Be More. This is the event that's going to turn everything around for you. 2 days, Las Vegas, women your age. You got to be over 40 to attend. It's going to be off the chain. Let us show you how to get your mojo back. Let us show you exactly what you need to do to step into your purpose, to get your mojo back, and have a freaking ton of fun doing it. Send me the word queen and I will send you your invitation because we need you there. Let's ask Joanna Stroeber, the CEO, founder, and visionary behind Midi Health, which is a virtual care provider program designed specifically to help perimenopausal and menopausal women. All right, Joanna, fact or menopausal myth? Menopause is something that you don't have to worry about until you're after or over 50.
Isn't that a crazy one? Menopause means that you didn't have your period, but actually perimenopause is the insidious one. And perimenopause starts in your early mid 30s. So it's just estrogen fluctuating and going down. But perimenopause symptoms can absolutely start in your 30s.
Do you think that one of the reasons why we don't associate or don't start thinking about menopause until we're much older, for example, we're not thinking about it when we're actually in perimenopause, is because there's such a negative connotation around that stage of a woman's life?
So, I don't know about you, but no one even mentioned perimenopause to me. So when I started having all these symptoms, they just said they were normal signs of aging. No one said, oh, this is perimenopause and could be related to your hormones. I think doctors are not trained to think like that. So you go in and you say, oh, I'm having anxiety, and they say, go to a therapist. They don't think, oh, it could be your hormones. Or, you go in and you say you're not sleeping. They say, oh, go get a sleep study instead of, oh, this is your hormones. So I think it's just that they haven't been trained to think in that way, like the holistic way of women's health. What I would like them to do is every time you start with a problem, let's start with the hormones, and then we can go to the other tests.
Well, with your help, hopefully we can make that happen someday. For me personally, I remember my mom, my aunt, older women who I was friends with, the way that they spoke about menopause was so negative and so scary. And so like, oh my, I don't want that to happen to me. So my question is it a myth or is it a fact that most women can just expect to struggle through that stage? It's just inevitable.
Well, there's two parts. Menopause is inevitable, but there is zero reason you need to suffer. That is really what I want to scream from the rooftops, is that pretty much every symptom of menopause can be treated. So there's zero reason for you to suffer. Menopause is inevitable, but suffering is not.
100% of women will go through menopause. If I'm hearing you correctly, 100% of women don't have to struggle in silence when they go through it.
That's exactly right. I actually joke all the time that, when your eyes start going, you just go get glasses. I actually think that menopause is like your eyes going. As they go, you go get glasses, you get it treated. We should have the same thought about menopause and perimenopause. As you get symptoms, you get them treated.
So is it inevitable that women, as they enter into the stage, their body's going to shift, they're going to gain weight in places they didn't expect, and they just have to basically buckle down and prepare for a different body?
No, that is not inevitable. It is inevitable that your body's going to change. But, there are a lot of different things you can do to fight that. Honestly, hormone replacement therapy actually helps quite a bit with the redistributing of weight. As your estrogen goes down, you start collecting more weight in your stomach. And so when you start taking estrogen, you can change that. There's also other things you can take like metformin and berberine. So there are a lot of different things you can take to basically not go through those issues.
I'm glad you mentioned berberine. There are natural remedies. There are supplements that we can take that help us to balance our hormones, especially because a lot of the minerals and vitamins that we think we're getting from our food, we're not. And or because of leaky gut related to a decline in our hormones, we're not absorbing those things the same way. So is it true that natural remedies are safer than HRT?
No, I wish, I think we have an idea that natural is better, but honestly, HRT is natural. It's not something that is foreign to your body. Estrogen is natural. As estrogen goes down, it creates a lot of these issues. So taking estrogen can just give your body what it naturally needs and naturally has. So you don't need to think of it as natural versus unnatural. I think that's actually a big misconception that we need to get over. There are supplements that absolutely work, and there are medications that absolutely work. And just like you don't necessarily treat diabetes with supplements, I would think of it like diabetes and treat with a combination of supplements and medications.
How about lifestyle? If I'm taking, I guess the myth is, because I see this question asked underneath my post. If I do a post showing the fact that I'm adding muscle, I'm lifting heavier, I'm getting stronger, I'm optimizing my health at this age, I'm healthier now than I was in my late 40s. And I will often hear people say, yeah, but isn't that because you're taking HRT? Like they think that HRT is going to solve all the problems. Does it?
I think it helps, honestly, but all those other things you're talking about matter too, right? I'm trying to get much better at lifting weights. We know that makes a huge difference. Lifting heavy, as you just said. We know that eating more protein and fiber makes a huge difference. We know that sleep makes a huge difference. Exercise makes a huge difference. All those things. So it's not just HRT, but HRT is a good start.
So it's all those lifestyle things. It's not just one thing, if I'm hearing you correctly. So that woman who thinks, okay, I've experienced some weight gain, I don't recognize my body, I'm having these other symptoms. If I take HRT, I'm going to lose weight this month. Is that a given?
That is not a given. HRT is actually more about redistributing the weight, as I was saying, help you so you store less in your stomach and can bring back your waist somewhat. There's actually some studies on that, but don't think of it as just one thing.
So for the woman who is worried about breast cancer because it runs in her family, or maybe she's had a previous diagnosis, or maybe her doctor said, absolutely not, that taking estrogen, as we've been talking about, is going to elevate your risk for breast cancer. Is it true, or is it a myth, that she is absolutely not a candidate for HRT?
It's one of the saddest myths out there, quite honestly. There is no evidence that taking estrogen when you do not have breast cancer elevates your risk of breast cancer. There's been a lot of really good books written on this. If you're really scared of it, go read Estrogen Matters by Avram Bluming. There's so many good books on this. It is a myth, and we need to get out of that myth. I think it's insidious. It's much easier to tell women, don't take this, you're going to get breast cancer, than it is to say, well, actually, the study shows that people who just took estrogen alone had a decreased risk of breast cancer. And it was the progesterone that was an issue, and the progesterone is a different kind of progesterone. You can see how complicated the story is, right? That story is just wrong. And there have been a number of books written about the fact that it's wrong, but it's still out in the ethos among both women and doctors. I will tell you, I meet with women all the time, and I'm like, you read everything that I write. And they'll say, I'm still scared of getting breast cancer. And that you do not need to be scared. I wish I could write it from the rooftops or yell it from the rooftops. If you do not have breast cancer, there is no reason to be scared of the connection between breast cancer and taking hormones.
What if you are a woman who's had a breast cancer diagnosis, or you currently have breast cancer? Is there anything she can do related to supplementing her hormones, or something topical, something for vaginal dryness, or is all of that off the table?
No, it's all not off the table. So first of all, if you have an estrogen positive breast cancer, that does mean that you should not be taking estrogen within the first 5 years. There's actually some emerging research. And again, I recommend Dr. Avram Bluming's book that shows that after 5 years, you might be able to take estrogen. And that's something between you and your doctor. But there's emerging research on that. But vaginal estrogen, totally fine if you have breast cancer. We actually have a facial estrogen that we create that's very low estrogen, but it works on your face and it can thicken the skin on your face. The same way it thickens your vagina does the same thing. So then you can actually go back to having enjoyable sex again after having breast cancer. And then additionally, there are medications. There's medication like Veoza, which is a really good medication for women who have breast cancer. So there are emerging other medications as well. So I actually think what I love is we have a doctor, Dr. Mindy Goldman, who works with us. She leads the UCSF survivorship clinic and focuses only on breast cancer survivors, and she's our chief clinical officer. She has created an entire apothecary, is my best word, of options for women who have breast cancer and trained all of our providers in that. What she says all the time is you do not need to suffer. And even if you have breast cancer, you do not need to suffer the terrible symptoms of menopause, and that we can help you. And that's what we want women to know.
So many women have they've been going to their same general practitioner for 15 years, 20 years. Maybe you've been seeing your OBGYN since you went on birth control. So now it's like decades of trust. And we hear from maybe that practitioner, oh, you don't need to worry about it yet. Listen, this is just a natural part of aging. And they're wearing a white lab coat. They are the authority. This is the person who's gone to school for these things. Yet I'm hearing other information on podcasts like this, right, from other experts. And I think she feels, well, we've been conditioned to believe, like, if it's a person of authority, they know better than us. So how do you approach that when you feel, first of all, intimidated to have a more in-depth conversation? Do I have to leave my care practitioner to get hormone support elsewhere? Can I do that in conjunction? Like, what should I do?
You're asking such good, hard questions, right? I think the truth is doctors are overworked and they have 6 minutes with you. And honestly, it's just much easier in that 6 minutes to say no. And that's really what I've learned. So and also you're sitting there and you're wearing a uncomfortable little robe and you're sitting on the table and you're like, should sex really be feeling like this? And, I'm waking up at 2:00 in the morning, and they kind of feel frivolous questions, even though they're not, because that's just the environment that we're sitting in. Honestly, one of the things that I love most about telehealth is that we can have these more honest conversations. They're much longer. It's much more comfortable to have it in my clothes than it is to be having it when I'm sitting there in that robe. The reality is doctors are wonderful, but they can't know everything. And so a primary care doctor, if one person comes in with a heart issue, the next person comes in with strep throat, the next person, they're not experts in women's health. And you're counting on that person to be an expert in women's health, and they just don't have the training for it. Most of them did not study menopause at all in medical school. An OBGYN in general will have 2 hours in medical school of menopause training. They are going to medical school to learn how to deliver babies. That is what an OBGYN, their major job is. That's what the training is about. And they do a really good job of delivering babies. And now we're expecting them to know everything about women's health, but they're not trained in those things. So it's just not part of the training at all. And honestly, after that Women's Health Initiative for the past 25 years, no training in medical school on this. So we have to basically, at Midi, we have to train an entire army of providers. We have created our entire training system. We read all the research and we then compile it, and then we share it with all of our NPs. And then we put them through a very intensive training program to make sure that they are up to date on all of the issues regarding estrogen and testosterone and progesterone, and really, how it's interrelated with your thyroid and how it's interrelated with your bone health. It's all connected, right? And so we have to really change how the doctors think about providing this care and think of it as holistic women's care instead of, oh, you have a headache, go to a brain doctor. Oh, you have a broken bone, go to an orthopedic surgeon. We have to really change the paradigm of healthcare.
So the next myth I want to ask you about with regard to hormone support, I've heard that none of this is going to be covered by insurance, and I don't have the funds to pay for treatment out of pocket, so therefore I'm out of luck.
So actually, estrogen and progesterone are absolutely covered by your insurance. So as long as they're prescribed by a provider, it can be a nurse practitioner or a physician, your insurance will cover, or pretty much all insurance will cover estrogen and progesterone. It doesn't cover testosterone.
Why?
How crazy is that, right? They will cover men's erectile dysfunction medications, but they will not cover testosterone. That does end up being out of pocket. But the estrogen and progesterone should always be covered by your insurance. You should not have to pay out of pocket for that. There may be a copay, but you shouldn't have to pay for the whole price out of pocket.
So even to see a practitioner, like say, for example, if I wanted to see someone at Midi, is my appointment, if my insurance is in the network, would it be covered?
Yeah, your insurance is covered. The average person pays us a $20 copay. So yes, your insurance covers our visits and covers the products.
Can we talk a little bit about testosterone? The next myth I want to address is that hormone replacement therapy really just is estrogen and progesterone. Is there any truth to the idea that testosterone is a male hormone?
So women have testosterone. We actually have a lot of testosterone in our bodies. We are not just estrogen and progesterone. We have a lot of testosterone in our bodies too. And that also goes down as we get older. And honestly, it's one of the reasons why women lose interest. They lose their libido. But there's emerging research, and I'm going to hesitate. I'm only hesitating because it's emerging research, and I want to say that. There's emerging research that does connect testosterone to mental acuity, to bone density. And I believe in that research enough that I'm actually taking testosterone, and I'm very excited about it. And I am excited about the emerging research. There needs to be more research. Women come to us now for testosterone, and they want it for more than just libido. And we are prescribing it for more than just libido.
Makes sense. Is testosterone expensive if I am paying for it out of pocket?
It shouldn't be too expensive, but it is, you should absolutely pay less than $100 a month, but it probably ranges from $50 to $75.
Joanna, I feel so bad for the women who are like 10 years to 20 years older than me, who were really at that age when this was so important, and the Women's Health Initiative was plastered all over the news, and hormone replacement was immediately taken away from them, villainized. So many of those women, I think, are the victims of that misinformation. Is it too late for a woman who's 65 or 70 and she's saying like, oh, I missed that window?
It is not too late. Absolutely, it is not too late. My mother uses vaginal estrogen. I think she's 83. You can use it forever. There's no reason to not do that. And honestly, I want to just say one thing. You said you feel sorry for the women older than you. I feel bad for the women today because they're still misinformed. It's not just women who are older than us. It's women of our age.
You're right.
Who are experiencing this. And so that's part of why I want to really be very vocal about this, because these are women coming to us every day who are saying these things. It's not just older women who didn't get access to the right care.
We are always talking about men and their risk of having a heart attack, but we talk about women and their risk of breast cancer, but is it a myth or is it a fact that we have a greater risk of heart disease than we do breast cancer?
We do. 30% higher risk of heart disease. And that starts when our estrogen goes down. We actually have the same risk as men until our estrogen starts to go down. But once it starts to go down, then our risk increases.
I just feel like there's so much intuition for our own bodies. Like for some women, not all. Again, I think some people don't even know what they feel. They don't keep track of their symptoms. They don't record them. So then they sit down in front of their practitioner. They ask them, okay, what are you here for? And they're like, I don't remember. And they're like, you have any symptoms? And they're like, I don't think so. Meanwhile, their husband's been hearing them complain about the fact that their skin is so dry and, oh my God, my hair is just not cooperating. Like we forget all these little things and we don't even realize like, wait, this might all be related. So there's two schools of thoughts in the experts I've had on this show. I've had menopausal experts who are like, you don't need labs at all. I just want to talk to the woman about her symptoms. And then I've had that expert on who's like, no way. You got to look at labs because she's not in touch with her body. She doesn't even have time to track her symptoms. And then I've talked to those who are like, it's kind of a combination of both. What's your belief?
So I want to say I'm not a provider, right? I do run a big company that has a lot of providers, and even probably within them, there's some differences. But what I think is that our job is to listen to you. So if you would like to have a blood test and it would make you feel better to understand where you are, that's great. Let's get you that blood test, and I can get it for you prescribed, covered by your insurance. Let's get that data and let's iterate on that. If you just come in and you say, I'm having brain fog and I'd like to try hormones and I don't want a blood test, that's okay too. I don't think it's our job to dictate to you how you're taken care of. I think it's our job to listen to you and give you the type of care that you are hoping for. That is how I like to think of it. Again, all about safety. So I want to say, for example, with testosterone, you have to have blood tests, right? If you're going to take testosterone, we're going to make you get quarterly blood tests to make sure that testosterone is not too high. And that is very, very important. And we're going to monitor you very closely to make sure that's the case. But if you would like to try estrogen and progesterone and you want to get a blood test, that's great. If you don't want to get a blood test, we can do it like that too. I guess I'm creating the kind of medicine that I want, which is it's around the way that I would like to be taken care of. I think that's our job, is to take care of you in a way that you feel comfortable with.
I love that. It's just so important. And I think that's how the best companies evolve with someone at the top, a visionary who's like, why doesn't this exist? Like, if I had a magic wand, this is what it would look like. And to be able to create something like that that provides such a solution is pretty freaking cool, I have to say.
Literally, my entire management team is women over 50. We are creating the medicine that we want, right? Like, we really are creating the medicine that we would like to experience.
The woman who is right now thinking to herself, okay, I need to keep an inventory of my symptoms. What are some of the more common complaints? We've mentioned sleep. We've mentioned hot flashes and night sweats. We've mentioned osteopenia. But what other symptoms would she be able to, or would you suggest you might consider that this could be perimenopause or could be related to your hormones?
Yeah, so joint pain is a big one. That is definitely something we see. Vertigo is an interesting one. Itchy ears is one that we hear a lot.
Like on the inside, I've had that. Oh my gosh, that's so crazy. Like not the outside of the ear, like it feels like there's an itch you can't get on the inside of your head. Okay.
When you talked about your hair starting to get thin and not looking the same, I was having all these little teeny hairs that were coming out here because my hair was starting to fall out. Your skin, estrogen, there's receptors on your skin. And so getting, part of aging, you can actually, think about helping with hormones. A lot of things around anxiety and depression that are related to your hormones. So we do see that a lot. Those are probably the most common ones.
Do you recommend that people keep track of these things? Like, should they keep a record of them? How do you recommend that and because again, sometimes I experience some symptoms and it would just be for a couple of days and then I forget about it because it wasn't like persistent.
Some people really like tracking, and there's nothing wrong with tracking, right? Like some people have the personality type that they really like to track things. And, there are plenty of apps out there that could do that. I know that Flow is introducing a perimenopause tracker. So a lot of women probably use Flow as a pregnancy to help them with pregnancy or period tracking. And now they're introducing a perimenopause tracker. There are trackers that are good. So if you want a tracker, go for it, use it. But honestly, you don't need a tracker. If you're not feeling right, just go get help. Like, you don't need to come in and tell us how many hot flashes you were experiencing. It's not like if you're a pregnancy, you have to track everything really closely, or if you're breastfeeding, it's not quite like that. If you feel a little off, you can get care. You don't need to come in and tell me, here's how many hot flashes I had, and here's how many nights I didn't sleep, and here's what time I woke up. If that is helpful to you, that's great. I have a personality that doesn't like doing those things. Maybe I have ADHD a little bit and I just don't want to track all that. Again, it's about what helps you to be effective in your life.
Lastly, Joanna, I want to know, what is it you're most excited to see in terms of change for women who are seeking this kind of support and their access to it?
I am excited that women are being proactive and saying, I deserve better care. Because I think it starts with that, because you do. You deserve great care by providers who understand your body and understand women's health. Until women start searching for that, there's not going to be businesses that provide that. So it's a vicious cycle, right? We need businesses that provide expert care to women, and we need women who are looking for that. And once we have both those things, then we will have an economy of companies that are providing that care to you. I'm excited that women are saying, we demand better care. We demand access to expertise, and we want to feel better. And it's that demand that's creating the opportunity to create companies that will solve that demand.
We talked about testosterone and how it's not covered currently for women. And is that because it's not FDA approved for treatment?
It is not FDA approved. That is correct. It is not FDA approved for women. There are really good studies that show that testosterone can increase your libido. We know that, but there is no FDA approved testosterone for this. And, I think it's because testosterone is a generic medication, so there's no lobby for it. So, and the same thing actually for estrogen and progesterone, right? When there's a lobby for something, then there's big companies making big amounts of money on it. Then they go lobby to get something FDA approved. In this case, these are generic medications, so there's no one lobbying to get it approved.
Do you predict that could change? Like big pharma getting involved?
No.
Oh, interesting. So if it's not FDA approved, meaning it's not covered by insurance, but I'm someone who's working with my practitioner at Midi, and I I want to increase my testosterone. I think that's what's going on with the reason why I'm not as strong in the gym. I'm having brain fog, my libido, like all these things. And I want to try increasing my testosterone. Is this something that they can prescribe off-label?
Yes. So that's what we do. We prescribe it off label. We send it to compounding pharmacies. We have it right now in 15 states. And by the end of next year, we'll have it in all states. But it's a very complicated regulatory network in order to get approved to do this on telehealth. So it just takes us time. But we do have 15 states, and we will have all states by the end of next year.
Amazing. Tell me, what sets Midi apart when it comes to telehealth? And, this woman who's going to be talking to somebody virtually about her hormones. What sets Midi apart?
So first and foremost, what I would say is that Midi is a listening company. The first thing we do is listen to you. My engineer was hilarious when we first started the company and we were taking care of people. He used to say, are we a therapy company or are we a medication company? Because women would say, I felt listened to and heard and paid attention to. That is our ethos. So there are plenty of other companies that will sell you a medication. You can go buy estrogen and testosterone from other companies. But first and foremost, we have trained our army of providers on the medications that are available, on the supplements that are available, but also to listen to you and to help you to understand your body differently. So that is something that is different. We are the only company out there that provides insurance-covered care. Your insurance will pay for your visit. The first visit is 30 minutes. We're going to spend 30 minutes understanding you, understanding your background, understanding your medical history, your family history, and make sure that we really understand you before we prescribe medications to you. And then we're also going to understand your interests. What do you care about? Are you looking for only supplements? Are you interested in medication? Like what are your priorities? And then our job is to take care of you the way you want to be taken care of. Because we're not trying to make money just selling you products. We do get paid by the insurance companies to take care of you, but it's through our care. And so that is different than everyone else.
And you've advocated to make that possible. So I just want to take a moment to honor you for having this vision, for the fact that, you were experiencing some of these struggles yourself and being just committed to solving this problem for yourself. And in the process, perhaps hundreds of thousands, maybe millions of women. I am just delighted that I have the opportunity to tell women there is an option for you, because for years I've been talking about this on my show, and the answer I would have to give a woman when she was like, my doctor said I'm not a candidate, or I can't find anyone in my area, I was like, oh, keep trying, like there wasn't a solution. So it's really nice to be able to say, like, here's an option.
Yeah, it's true. I'm really proud of our providers. Honestly, what I'm most proud of is them, that they work really hard and they really care about their patients. And every day I come and I get on LinkedIn and I get these messages from people saying, how grateful they are to their providers. What I really am excited about is that we've hired this incredible group of women who care deeply about their patients and really work hard to help their patients thrive. And that's really what it's about.
Well, thank you so much for what you do. And thank you for being a guest here on the Chalene Show.
This was so fun. We love you. So thank you.
I love what you guys do. I'm just thinking about it too often, probably. I've got so many ideas. I'm like, let's do a Super Bowl ad for Midi. I've got it. Like, that's that's the only part that the women are going to watch. Like, let's make an incredible Super Bowl ad. There's just so many great things. And I have to say, I very rarely partner with, I'm super picky, because then I feel like I'm customer service for that company, but nothing but positive feedback. The very rare, exception, which is going to happen, you guys jump all over it. So it's really nice to have that level of care and commitment, and the fact that you guys take the quality control and the way you follow up with your patients, the intake form, phenomenal. Every bit of feedback I've offered, they're like, we'll incorporate that. I'm like, this is amazing.
That's what's the good thing about being a startup, right? Like, we can listen and iterate really fast. So we do take feedback. Whenever we get feedback, we have a whole way of responding to it. But being a startup and we're not part of an old institution, we can iterate a lot. So, we get feedback from the women and they say, oh, I would like to find out about this kind of supplement. Can you do some research on it? And we'll go do research and find out if it works, right? So that's actually one of the most fun things about running this, is that we get to keep iterating and just making things better.
I hope that you found that super helpful. Every single expert who's been featured in this episode will be below in our show notes. And I want to say this, if you don't currently have a a doctor, a practitioner, somebody who's helping you to figure out what's going on with your hormones, I encourage you to give Midi a try. Again, it's chalene.com/Midi. I want to thank them for sponsoring this episode because it's providing a solution to so many of you. And please leave me a comment below and let me know, what has your experience been with hormones? Like when you went to talk to your doctor about it, what did you hear? Did you get the answers you needed? Thanks for watching.